Good evening, everyone. I am Dr. Manish Goyal, working physician, MD Medicine, based at Pathankot, and I am in practice since the last more than 22 years. I have been practicing all fields of subjects of medicine, including hypertension, diabetes, related complications, fever, and the wide range of. I am having a wide base of cardiac patient, diabetic patients, and patients with different sorts of fever. Today, I will be talking on understanding hypertension. This is a very basic topic, and I will be covering very basic parts only, not going into very details of hypertension. Generally, everyone would like to have healthy or normal blood pressure, but what exactly does this normal blood pressure mean? Each time when a heart beats, it blood pumps blood into the blood vessels. This creates pressure against the walls of blood vessels, which is called blood pressure. So, blood pressure is actually the pressure exerted against the lateral pressure exerted on the walls of blood vessels. Normally, in a healthy person, it rises and falls throughout the day. But when blood pressure remains high for a long time and left untreated, it can lead to serious health implications. This is just because of the damage to the blood vessels caused by the lateral pressure exerted by hypertension. So, in general, persistent increase in blood pressure higher than normal blood pressure, it is called hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices, that is not having routine exercise schedule, or because of smoking, high alcohol consumption, stress. Normally, hypertension is basically most common form is primary hypertension, and the other category is secondary hypertension. Primary hypertension is basically inherited from the parents. Most of the hypertension, nearly to the tune of 80 to 90%, is primary hypertension. There are other risk factors that can also increase the risk of developing hypertension, such as age. As people get older, the arteries become more and more stiff. So the pressure exerted by the column of blood moving through these arteries on the lateral wall increases relatively. Family history of high blood pressure is one of the major cause of hypertension. Excessive salt intake is also known to raise blood pressure. Not eating foods which are rich in potassium and can also increase the risk of hypertension and related complications of hypertension. Eating processed and fatty foods increases fats throughout the body and make heart work harder to push blood through the body, hence causing hypertension. Another cause is stress. Stress is a very common cause for increase in blood pressure. So stress management is an important part of treating hypertension. Moving on, hypertension does not have any obvious signs or symptoms. It is a silent disease. I call it a silent killer. It puts people on at risk of severe disease, several diseases such as cardiovascular problems to kidney failure, stroke, or even eye damage and blindness. Basically, wherever the blood vessels are, all these blood vessels can get damaged with time due to high pressure. So the blood pressure or hypertension affects each and every part of the body. Hence, even an accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way to know whether the person is having high blood pressure or not. Either otherwise, some people assume that the headache is associated with blood pressure. I always tell them there are no symptoms of hypertension. You have to get your blood pressure checked, you get a diagnosis of blood pressure, and that has to be done on a regular basis. Not that you have got it checked once and you forget it and never get it checked, never get it checked. Because today you may not be having hypertension, but after 6 months to 1 year, you may be having this hypertension, especially if the disease is prevalent in your family, especially in your parents, mother or father. Generally, when symptoms do occur, they include morning headache, mild headache is there, dull headache, especially in the occipital region, or tiredness. vision changes, blurring in the eyes, fatigue, nausea, and vomiting. These may be symptoms may be present in some people or may not be present in few people. If if a person is experiencing some of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed and easily treated also. It is usually measured with an instrument called sphygmomanometer. A blood pressure is recorded in two numbers, systolic and diastolic. Systolic is the upper one and diastolic is a low reading. A healthy blood pressure should be lower than 120 by 80. 120 systolic and 80 diastolic. Hence, the upper number indicates systolic, which means pressure in blood vessels when the heart contracts, where the lower number indicates diastolic blood pressure. If the blood pressure, there is not a single reading, 120, 80 is not the single reading which has to be taken, but there is a range of systolic blood pressure and the range of diastolic blood pressure which is taken as normal. If blood pressure, upper reading, systolic blood pressure is more than 140 and diastolic is more than 90, then only we label the person as having hypertension. The risk of heart disease associated with the hypertension is the major problem which can cause to long term disability or health issues. These risks can be prevented and reduced by taking steps toward a healthy lifestyle such as regular exercise, healthy diet, quit smoking, and regular reduce alcohol intake, regular blood pressure monitoring, stress management, and strict adherence to medicines. If blood pressure is successfully controlled with such lifestyle modifications, then it might avoid delay or reduce the need for medication. So, let us look at the strategies one by one. First is regular exercise or physical activity. Exercise can be drug-free approach to lowering the blood pressure. Regular physical exercises makes person heart stronger. So what our recommendation is daily 30 to 45 minutes of brisk walk at least 5 days a week. That is must for each and every healthy individual who can walk. Those who can't walk, they can go for aerobics, jogging, swimming, or some other sort of exercises. But exercise is must, and it is the most important thing which is required to control the blood pressure. Besides blood pressure, exercise also helps you in controlling a number of diseases and increasing your immune response to many other diseases such as COVID also, which is prevalent nowadays. Secondly is healthy diet. What do we mean by healthy diet? Healthy diet means DASH diet or a Mediterranean diet, eating less saturated fat and total fat. Getting plenty of potassium. There are plenty of foods you can surf online which contains high potassium, mainly the fruits. And fourthly, limiting the amount of sodium in the diet and limiting alcohol consumption. DASH diets for dietary approaches to stop hypertension include these are grains, fruits, vegetables, low fat dairy products, and skims of saturated fat cholesterol can lower one's blood pressure by up to 11 millimeter mercury if having high blood pressure. Each and every activity has its own role in lowering the blood pressure. There is no single activity which can bring your blood pressure to normal. So you have to take care that all these activities such as diet, exercise, salt restriction, alcohol restriction, smoking restriction, they have some role to play. Secondly, reducing sodium in your diet. Even a small amount of sodium in the diet, reduction in small amount, can improve the health of the heart and reduce blood pressure by about 5 to 6 millimeter if you are having high blood pressure. To reduce the sodium intake, we should inculcate in us the habit of reading the food labels. Yeah, we should be eating less of processed foods because sodium is added as a preservative in these processed foods, and we should avoid add extra sodium to our diet, to our salads. Next, very important thing is quitting smoking. Smoking needs to be quit, and zero smoking policy should be adopted. Regular blood pressure monitoring. Some people are in the habit of assuming that their blood pressure is normal because they are not having any symptoms, they are not having a headache. This assumption is totally false and baseless, and that should be discouraged. BP cannot be assessed through your symptoms. It has to be monitored and has to be checked by yourself. Either you can have a self BP monitoring system or you can get it checked from the doctor. Next, very important thing is stress management. Stress management, everyone should know how to relax and manage stress. Either it is home stress, family stress, or work stress, or environmental stress. All these needs to be managed so that you have a proper sound sleep, and sound sleep means sleeping without any dreams, so that you wake up in the morning, you feel fresh and you feel you are energetic in the morning. So that is sound sleep. If you are not having sound sleep, it means you have not managed your stress. And stress management will help you in curtailing the intake of medicines which we are giving you for blood pressure. Very important thing is adherence to medicines. Some people are in the habit of taking medicine and skipping them for 1 or 2 days in between. They take medicine on a regular basis for 1 day, 2 day, they don't take, they forget for 5 days, 7 days. This habit should be avoided because maximum time we have observed that those people who have their attacks such as brain attack, brain hemorrhage or heart attacks, these are those kinds of people who have skipped their medicines for 5 days, 7 days, 10 days or a couple of days. So never miss your medicines. Once you are on a medicine for blood pressure, the there are chances that this medicine is lifelong, unless and until there are some secondary factors such as obesity which you cut down, which and other lifestyle changes which you change, your BP may be controlled. If it was a borderline high BP, if it was very high BP 180 200, then you need to take your medicine throughout the life. If your blood pressure is controlled, it is controlled with medicines, not without medicines. The moment you leave your medicines, the BP will start rising again and you will be back to the same scenario. At last, I would like to suggest there is nothing more precious than having a fit and healthy life. Adopting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure with regular monitoring and preventive care. If you maintain your blood pressure to the normal range, you are likely to prevent many diseases which are associated with blood pressure. Today, you may be avoiding one medicine or two medicines for your blood pressure, but if you are doing so, you may end up in having heart disease, brain attack, kidney failure. So you will be taking a 15 to 20 medicines on a daily basis, along with uh, many diseases which you will be having facing lifetime throughout your lifetime. So better to take one or two medicines for your blood pressure or the medicines prescribed by your doctor for your blood pressure, so that you don't have those secondary diseases which are associated with blood pressure. Thank you.